Hey everyone, in this video I want to discuss my experiences during my first clinical experience and what I felt going through it and how it went. The goal of this video is to ease some of the anxiety nursing students may be experiencing going into their first clinical experience. I will also share with you some tips on how you can utilize your time in the clinical setting to learn as much as possible, and you can ultimately become a better nurse because of it. Thank you for watching this video. If you like nursing content, consider subscribing as I upload a new video every Thursday. Also, be sure to give the video a thumbs up if you found the video helpful. My first placement for my clinical course was on a sub-acute medical floor at a major hospital. It was a completely new environment and I had no real experience in a hospital setting prior to this, so I was quite afraid the night before. I didn't know what to expect and how to best prepare for my experience at a major hospital. However, when the day came, I realized that my instructor really took her time introducing us to the floor and teaching us everything we needed to know in order to pass our first clinical. The first day was all about introducing ourselves to our instructor and colleagues and figuring out the best ways we can prepare for this clinical experience. This really helped ease my anxiety going into the rest of the clinical experience as I understood what the expectations were in this course. So I want you nursing students to know that your instructor will take their time introducing you to the unit and making sure you are comfortable being able to learn in this environment. By the end of the first clinical course, you will typically demonstrate your head-to-toe exam, obtain vital signs, be able to administer basic medication, and to chart on all of this appropriately. That was the goal of our first clinical experience, which seems incredibly simple now, but back then, when I was nervous, anxious, and I really did not know how to perform these tasks efficiently, it was quite challenging and stressful. With that being said, here are some tips I would give for nursing students going into their first clinical experience. Number 1, come with a notebook in hand. Be prepared to write down important pieces of information, whether that is nursing tasks your instructor gives you or basic codes for opening the various doors to get access to different equipment. You need to be able to quickly write down various things, and it will help you a lot if you have a small notebook to quickly write them all in. Also, what I like to do during my clinical was write down things I wanted to learn more about. For instance, if I saw a lot of patients with congestive heart failure, I would want to research a bit more about that. If I saw a certain medication prescribed all the time, like pantoprazole, I would write that down and try to research more about it. Number 2, during downtime, research about the mechanism of action of medications and try to remember what they do. There was a lot of downtime in my first clinical experience because the instructor had to watch you perform various tasks in order to prove your competency. That ultimately meant that you will have a lot of time that you aren't really doing anything. That is when I took the time to research about various medications I was giving and tried to remember what the medications did. I would quiz my colleague on these various medications so that we were both learning and making great use of our time. Number 3, learn about the pathophysiology of the conditions patients had and what that means from a clinical perspective. Unfortunately, many patients that are on a sub-acute unit have quite a bit of comorbidities. Taking the time to research about these various comorbidities really helps you for the theory courses you will take and will ultimately help you become a more informed and competent nurse. You have to remember that prior to nursing school, the concept you learned in courses weren't really used after that term. However, as a nurse, you will always need to know the theory and pathophysiology of various common conditions. It is not something that you can forget and never use again. As a result, it is important to take the time and learn about the various conditions you see and try to relate them to patients' clinical presentation. For instance, understanding why a patient that has congestive heart failure could be short of breath and requires oxygen is just one of the many things that's good to research during your spare time. So there you have it. Those are some tips for nursing students going into their first clinical experience at the hospital. If you're a nurse watching this, what do you remember from your first experience? And do you have any tips to share with other nursing students? Leave a comment down below. Thank you so much for watching, and I'll see you in the next video. Oh, and good luck to all you nursing students out there going to your first clinical. You'll make it through nursing school and you'll all do great.